I'm going to begin skill number 21 now. This is provide Peri-Care for female. This skill is done on a mannequin. I've already assembled my equipment, which is my bath basin, my bed protector, 2 wash rags, a towel, a pair of gloves, and soap. I'm going to come in and do my pre-procedure actions. We do our pre-procedure actions before and we do our post-procedure actions after each skill. Doing these consistently will help you pass this test. Remember, on the CNA test, you can always do extra, but you cannot omit any steps. So if you do a step that is not called for, it won't be counted against you. And remember as well, if you make a mistake on the skilled test, tell your evaluator. Tell your evaluator you would have done whatever it is that you've forgotten. And if you're on the same skill, she will give you credit for that step. Okay, I'm going to begin now. Not pause, enter. Hi, Ms. Jones. My name is Ann, and I'm going to be providing Peri-Care for you today. I'm going to provide privacy. Make sure the bed is low and it is locked. Wash my hands. Okay, now I'm ready to begin the skill. Ms. Jones, will you fill this water for me? Okay, she says it's good. I've already filled the water. It is good. I'm going to put the bed protector underneath Mrs. Jones. Always keeping your client covered as much as possible, avoiding overexposure. I'm going to pull the sheet up, exposing only her perineal area. I'm going to expose this leg a little bit just for the camera to see, but you will want to keep this leg covered as well. I'm going to apply my gloves before washing the perineal area. Remember, you can apply your gloves at any point in the beginning, but you must apply your gloves before washing. There are several steps like that are order dependent, and they're typically, you must do this before that kind of steps. I'm going to wet my wash rag and apply soap. As I wash the perineal area, I'll be moving from front to back using a different area of the wash rag for each stroke. I teach my students to do 3 strokes. We start in the middle and we go front to back, change our spot, one side, front to back, change our spot, another side, front to back. Now I'm ready for my rinse rag. When rinsing, you're going to do the same thing, but you're not using soap. You'll go middle, front to back, side, front to back, and the other side, front to back. Now, I'm going to dry it, going front to back. If you want to dry once, that's sufficient, but if you go twice, make sure you change the spot on your towel. I'm going to move to the other side of the bed so the camera can see as I wash her bottom. So, let's see. Let me go over here. I'm going to turn my patient on the side. And I'm going to be careful to cover her except for her bottom. I've got my soapy rag here. And when you wash the bottom, you want to go front to back. Different spot. Front to back. Get your rinse rag. And again, you're going to rinse front to back. And front to back. And when you do drying, one time is sufficient, front to back. Now you finished with the skill. I'm going to begin removing the bed protector and turning my patient back onto her back. You want to remove the bed protector, making sure that you did not let it touch your uniform or your other dirty linen. Do not touch your uniform. That's going to go in the dirty linen cart. I'm going to take my basin the sink. I'm going to empty, rinse, and dry my basin and put it in the designated dirty supply area. I'll be out of the camera view briefly as I do this. Empty it, rinse it, and dry it. Remember, whenever we use a basin, we empty it, we rinse it, we dry it, and we place it in the designated dirty supply area. Now that we've finished using the linen and the basin, we remove gloves without contaminating ourselves into the waste container and wash our hands. I'm going to go back to my patient now. And we're going to do our post-procedure actions. Remember, the same post-procedure actions are done each skill. So it is remove privacy. Make sure the bed is low and it is locked. Give her her signal device. Here it is, Miss Jones. Call me if you need anything, and wash your hands. That's the end of skill